Good morning, one and all. Myself, Dr. Rupasri, consultant in obstetrics and gynecology, Hyderabad. Today, we are going to discuss a small topic that is urinary changes in pregnancy. So many will overlook this topic, but there may be some of the important questions which are important. So, let us discuss this. See, in the first slide itself, see, this is the bladder. Okay, and this is the uterus. See, as the uterus is growing, okay, this third, fourth, fifth, see, as it is growing, it will be compressing the bladder, the kidneys which are arranged, and the ureter. So, because of the compression of all the three compounds by the gravid uterus, what are the changes we are going to see? That we are going to discuss in details. Okay, now, kidney. In pregnancy, the kidney is enlarged by, there is enlargement of pelvis of the kidney, calyx, and the ureter. See, actually, this is a normal kidney. What I am showing is, so these are the calyces, okay, and this is the pelvis, and this is the ureter, okay. I'll write it. This is the calyx. This is the pelvis, and this is the ureter. Okay, this is the ureter. Now see, in case of pregnancy, see there is full dilatation. See, here it is narrow. See, there is full dilatation of the pelvis part of the kidney. See, it goes on increases. Okay, this is the ureter. See the dilatation of the ureter, and these are the, this is the pelvis part, and this small narrow is there. No, this is the calyx. So, in pregnancy, there is enlargement of the pelvis of the kidney, calyx, and the ureter. Now, the renal plasma flow increase by 50 to 75% from 16 weeks to 34 weeks. Okay, in kidney, in renal, we see the renal plasma flow. Along with that, we see the glomerular filtration rate. It also increases by 50%. Because of the increase of glomerular filtration rate, urea, uric acid, creatinine levels are very low in a pregnant woman. So there is much amount of filtration present. So all the urea, uric acid, creatine, everything will be excreted by the pregnant woman. And last important point is there is decreased tubular reabsorption in the pregnancy. Tubular reabsorption in pregnancy. So glucose, vitamin, amino acids are all excreted in kidney, excreted through kidney in pregnancy. Okay. So what are the important questions they are going to ask you is, one thing, will there be any enlargement of the kidney in pregnancy? Yes. Kidney increases by 1 centimeter in pregnancy. Kidney increases by 1 centimeter in pregnancy. There is enlargement of the pelvis and calyx and ureter. Okay. See, this is the ureter. See, there is a this is the dilatation of the ureter in pregnancy, and see how narrow it is here. And this is the pelvis part. See how wide it is, this pelvis and all. See, this is the pelvis part. See, here it is little narrow, and these are all the calyx. Okay, so these are all the calyx. Okay, these are all the calyx. And the renal plasma flow, glomerular filtration rate, how much will they be increased in pregnancy means almost 50 to 75% there will be increase in the. And last is because of the increase in glomerular filtration rate, urea, uric acid, creatinine levels will be very low in a pregnant woman. Why? Because increase in the glomerular filtration rate. Now, next. See, ureter. Ureter. See, in pregnancy, ureter is atonic. Means there is a sluggish movement of the ureter. Why? Why? Because of progesterone. Progesterone hormone. There is sluggish. There will be jet-like water flowing within the ureter from the kidney to the bladder. But in pregnancy, what happens is because of the progesterone, there will be slight sluggish movement of the ureter. Okay. Next, there is dilatation of ureter above the pelvic portion on the right side. There is dilatation of the ureter. Why? Why? Because mostly on the right side only because of compression of ureter by the dextro rotated uterus. Not uterus, it is gravid uterus. Okay? Because of the dextro rotation of the gravid uterus, see the pelvic portion of the ureter is compressed. Therefore, see this is the ureter. Okay, see it is dilated above the pelvic portion. This is the pelvic portion. Above the pelvic portion is dilated. Therefore, because of the dextro rotation of the uterus. And next is at 20 to 24 weeks, there is scarcity of urine. Okay, as I said, the ureter becomes atonic. Okay, because of this, there will not be any jet flow of urine flowing through the ureter into the bladder. Therefore, there leads to scarcity of urine at 20 to 24 weeks. Next is there is elongation and hypertrophy of ureter because of the hormone estrogen. As I said, progesterone will cause static atonicity of the ureter, but the elongation of the ureter or hypertrophy of the ureter is mostly because of the hormone estrogen. And last is, all these points are very important. And the last point is there is outward rotation of the ureter in pregnancy. There is outward displacement of ureter during pregnancy because of gravid uterus. Okay, see, as I said, this is the abdominal portion and this is the pelvic portion. Because of the rotation of the gravid uterus, mostly to the dextro side, that is right side, the right side ureter will be compressed. Therefore, it will be dilated and at 24 weeks, see, one by one it is interlinked. Because of the dilatation and compression, there is stasis of the urine at 20 to 24 weeks. And in pregnancy, there is elongation of the ureter because of the hormone estrogen. And at last, there is outward because of the growing uterus. Because of the continuous growing uterus during the pregnancy, what happens is there is outward. This is the outward displacement of the ureter. In this, almost 5 to 6 questions are present. Every point is a question MCQ for you all. Atonicity is because of progesterone. And where is the dilatation of the ureter? Mostly because of the dextro on the right side. Stasis of urine is about 20 to 24 weeks. And elongation hypertrophy is mostly because of the estrogen. Is there any outward displacement of ureter during pregnancy? Yes. Now the last thing is bladder. See, this is the fetus within the uterus. This is the bladder. See, the fetus, the presenting part is compressing the bladder. Okay. Now see what will happen in this. In pregnancy, there is hypertrophy and congestion of bladder mucosa. In pregnancy, blood supply is increased to each and every part. Therefore, what happens is, because of the increased vascularity, there is hypertrophy of the bladder as well as the congestion of the bladder mucosa. What happens is, in early pregnancy, that is, in early pregnancy, first trimester, there is increased frequency of micturition. Okay, why? Why this increased frequency of micturition in the first trimester? Because there is change in osmoregulation because of increased water intake or polyuria or polyuria. Okay, there will be increased water intake and polyuria. So, in first trimester, there will be more times of urination by the pregnant woman. Why? Because there are changes, osmoregulation. Because first time the fetus has changed, there are so many of hormonal changes. So, what will happen? There will be increased thirst to the mother in the first 3 months of pregnancy, resulting in increased water intake as well as polyuria to the mother. And next, in the last trimester also, there is increased frequency of micturition. Why? Why? Because see the image itself shows, see the fetus is gradually descending down. Okay, it is about the time. So what happens? The presenting part, which is gradually descending down into the pelvis, compress upon the bladder. See, the bladder is getting compressed by the uterus, gravid uterus. Therefore, there is again increased frequency of micturition. The presenting part compress the bladder. So there is increased frequency of micturition. And last is in pregnancy, because of progesterone, all the splinters, including urethral, get lags. So there is stress incontinence in pregnancy. Every point has one reason. If you remember the reason well, then you can answer all the MCQs correctly. In this slide, see every word has its importance. In early pregnancy, why a pregnant woman is having increased frequency of micturition means because of the changes in the osmoregulation. Okay, and in the last trimester, it is because of the compression of the presenting part and the bladder. Okay, and last, why in pregnancy in last trimester mostly there is stress incontinence is because of the relaxation or laxity of all the splinters including the urethral splinter. Okay, there may be assertion and reasoning questions from this slide. Okay, I think you all understood this topic and we will meet with the next topic. Thank you.